Hi everyone, Amber Canoy here with Everyday Kentucky. So many people suffer with hip pain, arthritis in their hips, and we're over at Bluegrass Orthopedics with Dr. Charles Crouse. We're talking about that. So what are you really seeing as the symptoms that somebody could be suffering with a lot of hip arthritis?
So hip arthritis can come from several different areas. Come from the back, it can come from internally in the hip, and it can also come from the side. So typically what we'll see is alterations in gait and then pain that is around that area in the front, side, or back of the hip.
So for people who maybe not understand gait, how they're walking,
Right.
like are they having to adjust?
Exactly. Are they having to limp? Are they shuffling a little bit more? And sometimes they also have pain that might run down their leg at times.
Okay. So what would kind of be a treatment plan, or first I guess I should say, what would go on here to assess if that's really the issue?
So what we'll do is we'll ask a number of questions to try to elucidate more where that pain is coming from and if there's other factors that are contributing to that. But the main thing that we want to find out is there hip arthritis? Is there back arthritis? Is there bursitis of the hip? And there's different tests that we can do, not only from x-rays to physical exam tests, and we can try to figure out where that pain is coming from in order to best treat that pain.
So they've got the diagnosis. What does the treatment plan look like?
So again, depending upon where it's coming from, treatment can be anything as simple as activity modifications and anti-inflammatories or specific prescription drugs that we can send. We can also do injections at the time that they're at the visit, depending upon their symptoms and how bad it is. Sometimes people want to go straight to an injection, and that can provide some significant symptom relief as well.
And you want to make it convenient for people too if they have these issues to get treatment.
Absolutely. People can walk in and we can do a lot of those the same day without having to do other tests.
And multiple locations.
Correct.
All right, go online and check them out.
All right, thanks.